Welcome to the EADV podcast, the official podcast of the European Academy of Dermatology and Venereology. This episode marks the second of an extra monthly series covering some of the best venereology talks delivered at the EADV Congress in Berlin. Across the coming months, you will hear from 5 world-renowned expert speakers and interviewers covering various venereological conditions. But before we get into that, if you haven't already, check out our program of face-to-face courses offering high-quality theoretical and practical training covering a wide variety of specialties. Applications have already opened for courses for 2024, including infectious diseases for nurses in dermatology. Places fill out fast, so subscribe to our mailing list if you'd like to be the first to receive news of when courses go live. You can learn more at eadv.org. Today we are joined by Dr. Eija Hiltunen-Back, a leading expert on genital area skin diseases and STIs. She is a specialist and adjunct professor in venereology at the University of Helsinki, and her main research interests have been the epidemiology of STIs and genital dermatology. Dr. Eija Hiltunen-Back is in conversation with medical student and HIV activist Vladimir Grichishkin, discussing the revival of syphilis. Enjoy!
Syphilis is back again. Why are we facing this epidemic, even in the 21st century, when we have plenty of therapeutic options and diagnostic opportunities?
Well, there are probably several reasons for that. I think that during the COVID pandemic, people stayed home, they didn't travel, and they didn't meet other people. And now afterwards, they start going around and of course, get more infected. So that's maybe one reason. Of course, not anymore, but during 2020, when the increase was very rapid. Then we have a lot of people using HIV PrEP. So that has been a very big change in the field of STIs, because you have a first time a chance to avoid HIV transmission, and it's very important. But people forgot that there are other STIs too. We see it in gonorrhea and also in syphilis, so they are all figures growing up. And then even though we have a treatment for syphilis, penicillin, which have been for decades, and it's working properly, there's no problem with that. But if we think about human nature, I think that is maybe the most difficult thing to affect, so that you don't get the infection in the first place.
Thank you. It completely answers my question. But why do you find this topic interesting personally for you?
I have done STIs for 30 years, and I think syphilis is one of the most fascinating disease or infection, because you never know it properly. Every day you learn more and more, because it's very complicated in the nature. There are several stages, and also the clinical picture is very, very varying. And I think especially for dermatologists is a very big challenge. And that's why it's important to talk about it and to remind colleagues about the infection, because they probably see it in their clinics, but they don't realize that this might be syphilis. So it's too good to remind that we still have this old disease. But I think it's a challenge in clinical perspective.
Regarding the rising numbers of syphilis, can we also blame stigmatization of STIs and specifically syphilis for the situation we have?
Of course, because in all STIs, there is a difficult for people to go to the doctor and ask for a test. And maybe we providers don't offer very easily testing also, because we feel also a little bit awkward to ask that, could you have STI and can we test it? So it might be a problem that there is no access so easily for testing. And that's why I think that we know that we need low threshold testing places for those people who have a difficulty to go to the normal clinics.
How could we overcome stigmatization of STIs?
I think we have to educate the providers to talk about sex and sexually transmitted diseases like they are part of the normal life, and also to meet people with different sexual background and to accept everything and not to think about everything on your own way. So that is something which we need an education, I think. And also a lot of talking in public also that sexual transmitted diseases are part of the world and they are with us and we can try to battle against them. But anyway, we have to deal with them too.
doxyPrEP and doxyPEP tend to be very popular in the medical community from researching perspective, but also among K populations, especially in MSM community. How do you think can the expansion of these regimens will lead to a bigger number of seronegative cases of syphilis?
Actually, in Europe, we are working on that and thinking about how to react about maybe doing a new guideline or something, because we don't know everything about it. But I still think that there are a lot of questions unanswered. And if that happens, that we miss some syphilis diagnosis due to the doxyPrEP, so I think it's quite disaster. So if we found out those late forms, for instance, when it's not seen in the blood test as a serological positivity, so I find it still a big question mark, and I think we need to find it out properly. Is it worth to do it?
But theoretically, usage of antibiotics on the early stages of syphilis can lead to prolonged serological window. So that's why I was curious, because this tool really very popular, and we definitely can possibly face this situation with a lot of latent forms.
Yes, that's true. And we also have to think about other STIs, because it can affect gonorrhea, for instance, and things like that. So it's not so simple, because we can't use it only for one infection.
So this is a still very controversial topic.
Yes.
STIs and sexual health are very sensitive topics to work with. Can you name 3 personal qualities of yourself that you find vital for that kind of work?
I think that you have to have empathy for patient. You have to try to figure their position and their fears and things like that, so that you meet them at the same level, if you can say, that you are not a doctor that is up there and then you are giving orders, why didn't you use condom? But to talk about like 2 people at the same level. And then I love infections, and I love to solve problems. And I think that's the most important thing when you think about STIs. So you have to think about what could this be and rule out maybe other diseases.
What is needed to stop this epidemic of syphilis completely?
I don't think that we can do it completely. Never. It hasn't been done, not yet. Anyway, we need to educate healthcare professionals and also public that there is a disease and what are the symptoms and how to test. We need low threshold testing places, point of care test where we get the result very quickly. We have a proper treatment, so there is no problem with that. But also we need to really make good surveillance of the risk population and who need more the education and maybe preventive actions.
Thank you so much.
Thank you for listening, and if you haven't already, please make sure you subscribe on Apple Podcasts, follow us on Spotify, or otherwise you can find us on any major podcast provider. We appreciate you joining us and look forward to presenting more interviews, research, and other important topics. Stay tuned for the next episode of the Venereology Talks series, which goes live on February the 13th, covering the topic of monkeypox. Until the next episode, take care of your skin and sexual health.